I'm going to present this study and the current studies we are performing at the University of Padua about adolescents with idiopathic scoliosis. As you know, idiopathic scoliosis is a condition that affects the spine, altering morphology. But what if I told you that beyond the physical manifestation of these conditions, in adolescent idiopathic scoliosis, there should be also alteration in how we perceive our body, and so in neuronal processes and also in muscular activation. Oops. So just a few words of background. As you know, adolescent idiopathic scoliosis is a condition characterized by a three-dimensional deformity of the spine, characterized by a frontal spine deviation of more than 10 degrees and by a rotation of the vertebral bodies. It has a strong female to male ratio and a nonlinear progression with small differences in the basic condition that can cause large differences in the final phenomena. So during the years, different causes have been suggested to be involved in scoliosis onset and development. And among these, several changes have been reported. For example, considering gene with genetic predisposition, alterations in the metabolism on the folate or also in the estrogen receptors gene expression, but also biomechanical alterations have been reported, for example, with the Young-Stokes theory that reported an alterations on the load on the vertebral bodies with asymmetrical load causing alterations in vertebral development. Other theories have suggested alterations in metabolic and hormonal functions in patients with adolescent idiopathic scoliosis, in particular in the expression of leptin and melatonin levels. And finally, some theories have suggested alterations in the central nervous systems in different ways, as reported in the figure. So alterations in the sensory input can be involved, but also alterations in the coordinations in the sensory motor context, or also alterations in the motor expression, so in the motor output of the sensory motor integrations. So the integration in the cortex can be altered, but also the functionality of muscles in these subjects. One of the main theory reported for adolescent idiopathic scoliosis and central nervous system involvement is this theory, the so-called elevator theory, that says that skeletal maturations and bone growth can occur in such a rapid way that the central nervous system and body representations cannot be equally involved in the development of the body. And when we talk about body representations, we mainly refer to two different conditions. On the one hand, to the body image, that is an internal representation of the external appearance and involves emotional situations, memories, action resolutions. And it is not static, but changes according to personal experiences, tending to become stable during adolescence. On the other hand, when we refer to body representation, we refer to body schema. That is the dynamic representation of the position and the stand of the body that operates mainly without conscious awareness and integrates proprioceptive, motor, and sensory functions. In adolescent idiopathic scoliosis, both these two processes have been reported to be altered. In particular, body image have been reported to be altered in patients with scoliosis, since these patients report a greater dissatisfaction in their body, and this is even greater when referring to more severe conditions. Also regarding body schema, in all the adolescents, we have some alterations in their internal representation of the position of the body segments, but these alterations is even greater when referring to patients with adolescent idiopathic scoliosis, and it is more altered when we refer to dynamic sections. So when the patient is asked to report its body schema during dynamic phases of its daily activities. So in the hypothesis that body representations can be an indirect index of central sensory motor alterations, we have developed this study at the University of Padua with the aim to characterize the central mechanism of impaired sensory motor integrations in idiopathic scoliosis and to relate central sensory motor integration deficits to body schema disorders. We have included in this study 15 girls affected by scoliosis and 50 age and sex-matched controls, and they performed a comprehensive evaluation. These evaluations involved electroencephalography recordings in order to obtain a sort of photograph of the brain activity of these subjects in terms of milliseconds. Then we performed also evaluations of stabiliometry platform in different conditions, for example, with open eyes and closed eyes, but also standing with upper limbs abducted at 90 degrees in both the two conditions, so with open eyes and closed eyes. And finally, we performed the image marking procedure. That is this simple test in which participants are asked to stand against a white wall, and then the experimental touch different part of the body of the participant, and then the participant is asked to point out the part of the body that has been touched on the white wall that represents a sort of a mirror, and then we calculated the distance between the right point that has been touched and the point reported by the participant in order to detect alterations in body perception. So our results, these preliminary results have highlighted an alterations in brain activity in patients with adolescent idiopathic scoliosis with an increase in the relative power of delta and theta rhythms in central and peripheral areas compared to controls in all the tasks, so both with eyes closed and with eyes open. And also an increased alpha power have been reported in the sensory motor area in adolescents with a main right curve. And surprisingly, these asymmetries have been not reported when there were differences in balance control, because in patients with adolescent idiopathic scoliosis, we did not detect any differences in balance control in the evaluations using the balance board. So how we can explain these differences? Obviously, these are preliminary results, but maybe since several preliminary studies have detected an involvement of delta and theta rhythms in the maintenance of balance control, in particular when eyes are closed, we hypothesize that these asymmetries can be involved in the maintenance of postural control in patients with adolescent idiopathic scoliosis. Maybe they require a more important brain activity to maintain the stability and the balance. Also, regarding the image and marking procedure, we detected some differences between scoliosis patients and controls, with scoliosis patients reporting alterations in the indices of shoulders and hips, but also differences between controls when evaluating the inclinations of the interacromial axis. And in particular, the inclinations of the interacromial axis has been shown to be perceived as opposite from the actual inclinations. And this is important since our rehabilitative efforts can also be addressed to revert these alterations in perceptions. So now what we are performing now, starting from this base case control study, is to follow patients with adolescent idiopathic scoliosis over time with a longitudinal analysis in order to detect if conservative treatment can in some way alter or ameliorate the outcomes of patients also regarding body schema and brain activity. So we are now collecting data from patients with adolescent idiopathic scoliosis, both at the beginning and at the end of 6 months of treatment with a brace wearing. That is the main conservative treatment used for patients with adolescent idiopathic scoliosis. And what we are performing now, is brain activity evaluation through electroencephalography, but also electromyography in order to observe if these alterations observed in the sensory motor cortex can also be observed in the peripheral systems, so in the muscular systems. And we are performing these 2 evaluations while patients are asked to perform 2 different tasks. And these tasks are tasks that investigate the body schema of patients. The first one is a task used also in other kind of patients, for example, in low back pain patients. And it is used to evaluate alterations in body perception, asking patients to point the midpoint of the forearm hidden by a panel. And the other tasks is a task that investigate the peripersonal space and in which the patient is asked to observe an experimental touching a point on a protractor, and then it is asked to touch the same point with his eyes closed in order to investigate alterations not only in body perception, but also in the perception of the external space. So why we are now investigating also electromyography? Because there are some evidence of alterations in patients with adolescent idiopathic scoliosis, even in muscle activations. In particular, some studies have reported early activations of the muscle of the convex sides of patients with scoliosis, and other studies have reported an increase in the amplitude of the electromyography of patients with on the convex sides of patients with scoliosis. So we wanted to know if electromyography can have also a role in detect the outcomes of rehabilitative approach. And so we have mainly performed this review in order to investigate if other studies have examined this point. And we have found a lack of studies considering electromyography in rehabilitation, because mainly it is used for surgical purposes in these populations. So we have found only 5 studies considering neurophysiology in scoliosis patients with conservative treatment and rehabilitative treatment. And among these, 4 of 5 have considered electromyography, and only 1 have considered another kind of evaluations with evoked potential. So to determine muscle function and any alterations in this aspect in patients with adolescent idiopathic scoliosis, we still have to investigate, and so we are going to consider also this aspect. So there are preliminary, to conclude, there are preliminary results that suggest that neurophysiology and muscle functions, alterations and asymmetries can be involved in the onset or maybe in the development of adolescent idiopathic scoliosis. And these aspects can represent a mirroring of alterations in the sensory motor processes. But so far, we have a lot of studies to perform. And this, it is important not only for research purposes, but also to ameliorate the management of this kind of patients, since introduce these evaluations in clinical can help to improve the personalization of the treatment of these patients. So also referring different aspects of the rehabilitative processes. So I reported here two images. The first one, the possibility to integrate in scoliosis management, also proprioception exercises if body perception can be alterated, and the other side, the possibility to offer a cognitive support to these patients in order to ameliorate the body schema and body perception. So thank you very much for your attention.